I've discussed homocysteine before, but let's go through some details that he doesn't mention. First, the concern about elevated homocysteine levels started back in the 60s when a pathologist noticed it was a common factor in certain genetic conditions that cause premature heart disease in infants and children, as well as in the rare case of homozygous MTHFR genotypes. Then, in population studies, including epidemiological studies as well as case control and cohort studies, we see significant associations with vascular disease, especially heart disease and dementia. Homocysteine levels and MTHFR status are excellent predictors of all-cause mortality, with a 33.6% increase in the risk of death for every 5 micromole per liter rise in homocysteine levels. We know that homocysteine levels also naturally rise with age. We know that they're higher in males and in postmenopausal women. We also know that things like alcohol, smoking, and obesity are also associated with higher levels of homocysteine, along with inflammatory conditions like rheumatoid arthritis, severe psoriasis, and severe infections, as well as some cancers. We know that in the lab, exposing blood vessel cells to homocysteine causes excessive thickening by more than 200% and increased secretion of inflammatory cytokines. Furthermore, we know that deficiencies in B vitamins can cause elevated levels, and in patients who have elevated homocysteine levels for any reason, including genetic causes like MTHFR, B vitamin supplementation can reduce homocysteine levels effectively by about 18 to 27%. Now, I'd imagine that all of that sounds pretty convincing. Bullshit usually does. I can spin the bullshit theory even better than if I try. But continuing the theme of Feynman quotes, it doesn't matter how beautiful your theory is, it doesn't matter how smart you are, if it doesn't agree with experiment, it's wrong. So now, let's look at the actual experiments. There have been 3 major double-blind RCTs of B vitamins and homocysteine: VISP, NORVIT, and HOPE-2. All of them showed exactly the same thing. First, elevated levels of homocysteine were in fact a marker of risk for cardiac events and death. Second, B vitamins compared to placebo did effectively reduce homocysteine levels. And third, those with reduced homocysteine levels had no reduction in cardiac risk or mortality. Their risk corresponded only to their original homocysteine level, not their reduced level. So reducing homocysteine levels did nothing compared to placebo for the outcomes, despite the reduction in homocysteine levels. But you might be thinking, wait, what does this mean? How does this make sense? If high homocysteine was associated with cardiovascular risk and the vitamins lowered homocysteine, why didn't it help? The most likely explanation is that there's some third unknown factor that is responsible for causing both elevated homocysteine and heart attacks. This means that they're strongly associated but not causal. So when you lower homocysteine levels, because it's not actually the cause, it does nothing for your heart disease risk. Sadly, every few years another knucklehead rolls out the same tired associations and the bullshit artistry starts again, even on topics that have already been disproven. This fallacy, thinking that changing a correlated biomarker risk factor will change the outcome, is just like thinking that adding a Ferrari hood ornament will speed up your car, based on the strong statistical correlation between Ferrari hood ornaments and fast cars. I call this the Biomarker Bamboozle fallacy. It's obvious when I talk about hood ornaments, but when dresses up the same poor reasoning and they say homocysteine or serum bicarbonate levels or biological age by epigenetic factors, then the razzle-dazzle tap-dancing bullshit disguises the same tired, flawed logic and people get fooled.
Razzle-dazzle them and they'll never catch flies.
Homocysteine is just one of the few things where we've actually done a placebo-controlled trial to test if adjusting the marker adjusts the risk. It doesn't, but it's become a classic example of how the health influencer bullshit can lead us astray. So this biomarker bamboozle is the biggest contributor to what I call quantified quackery. It's the meat of that particular bullshit sandwich. So to protect ourselves, remember, when someone says association, anytime you see a study with the words relationship or association or risk factor, you should be aware that these are observational studies and should not lead to a recommendation. Otherwise, it's a biomarker bamboozle.